Hi, I'm Lexi. I'm going to be your student nurse today. Are you doing okay?
I'm doing good.
Alright, I would wash my hands and assess that the environment is quiet and comfortable, and it is. I would provide for privacy, and I would explain the procedure. I'm going to be doing a head-to-toe assessment on you today. Can I get your name and date of birth?
Yeah, it's Spencer Anderson. It's 4/1995.
Do you know where you're at?
I do.
And what day is it?
It's Thursday.
Okay, so first I'm going to inspect your face. It looks like the color is consistent with the genetic background. The only marks are some slight freckles and redness, but that's consistent over the whole body. And it is symmetric bilaterally, and there's no involuntary movements, edema, or lesions. Now I'm going to palpate the face for temperature. It looks like it's warm and dry. And then I would assess the lips. They are well moisturized, symmetric bilaterally, and there are no marked lesions or masses on the lips. And then I would assess the neck. It is symmetric bilaterally. There are no lumps or masses. It looks like the temperature is consistent with the rest of the body. It is warm. And then I would auscultate the carotid artery on both sides. Okay, normal findings. I'm going to palpate the trachea. Looks like there is no deviation and it is midline. Now I'm going to assess your hearing. Is it true that you've heard everything in this conversation clearly and you don't have any hearing problems?
Right.
Okay. All right. Now I'm going to assess your anterior chest. Can you lay down for me?
Yeah.
Okay. It looks like it is symmetric bilaterally. The temperature is consistent with the rest of the body. There are no edema or lesions. There's no moisture, and it is symmetric bilaterally. Now I'm gonna assess the breath sounds. I'm gonna assess the respirations. Looks like they are even and unlabored. And now I'm gonna auscultate in all the spots. I'm gonna start at the right. If you could just get a little closer, I'm gonna listen for a full respiration in each spot. Okay, and then I would palpate it in the same motion. Are you feeling any tenderness?
Mm-hmm.
There are no lumps or masses or edema or lesions. Now I'm going to assess the posterior chest. So I'm going to have you sit on this stool here and face your back this way.
Okay.
Okay, it is symmetric bilaterally, and it looks like the temperature is consistent with the rest of the body, and there are no edema or lesions. And now I am going to auscultate in the pattern. I'm going to start at the top, breathing it out at each one for me. And I would have cleaned my stethoscope before I did all of that on each one. Now I'm going to percuss the costovertebral angle under each 12th rib. Are you feeling any tenderness?
Nope.
Okay. Now I'm going to do the eyes, which I would have done after the face, but I forgot. So can you sit back up on the bed for me? Okay. They are round and equal in size, and I'm going to show this from the side. Just look straight ahead for me. Okay, there is direct and consensual constriction. Now I'm going to test your accommodation. Can you focus on a distant object for me?
Yep.
Keep looking. They are dilated. Now can you look at my finger? They constricted and converged. Okay. And then now I'm gonna move to the abdomen, or the heart. Okay, lay down for me.
Okay.
And if you could come closer now, I'm gonna inspect the precordium. Now I'm going to auscultate. I would clean my stethoscope. I'm gonna start at the angle of Louis and go over and down to the 5th intercostal space to palpate the apex. Okay. Now I'm going to do the left sternal border, which is also in the 5th intercostal space, but it's more proximal to the sternum. Now I'm going to assess the base, which is in the 3rd intercostal space. I'm going to do both sides with the diaphragm and the bell. There is no heave or thrill. Now I'm going to clean my stethoscope again, and then I'm gonna auscultate for the apical pulse. I'm gonna go down to the 5th intercostal space again. Found the apical pulse. I would count the rate and rhythm, and then I would clean my stethoscope each time I used it. I would clean it again, and then now I'm going to listen to the heart valves. I'm going to start at the aortic valve, which is on the patient's right 2nd intercostal space. I'm going to listen on both sides of my stethoscope. Okay. Then I'm going to do the pulmonic valve with both sides, which is also in the 2nd intercostal space, across from the other one. Then I'm going to go down to the herbs, which is in the 3rd intercostal space. Do both sides. I'm going to go down to the tricuspid, which is in the 5th intercostal space. Then I'm going to go over to the mitral, which is also in the 5th intercostal space. Okay, normal findings there. Now I'm going to assess for extra heart sounds and murmurs. I'm going to have you lay on your, I'm going to put this on your apex in the 5th intercostal space again. Can you lay on your left side for me? Okay, there are no extra heart sounds. And then I would do the base on both sides and the 2nd intercostal on both sides. And then I would do the apex again, and it looks like S1 is louder at the apex and S2 is louder at the base. Now I'm going to inspect the abdomen. It looks like it is, the color is consistent with the rest of the body. There are no marked pulsations, lumps, masses. The temperature is consistent with the rest of the body. Now I'm going to palpate in all 4 quadrants. I'm going to start in the left upper. Are you feeling any tenderness? I feel no lumps or masses at all. Now I'm going to auscultate all of those. I'm going to clean my stethoscope. And it looks like bowel sounds are present in all 4 quadrants. They are high-pitched gurgling sounds, and I would count it, but it sounds like it is within normal range. And then now I am going to assess the umbilicus. It is midline, inverted, no discoloration or hernia. Now I'm going to do the upper arm, so can you set up for me on the side of the bed? Okay, what are these here? Yeah, okay. Now I'm gonna inspect your shoulder, elbow, wrist, hand, and fingers. I'm gonna rub all of that. Start at your clavicle, move down to your scapula. Normal findings so far. Okay, I'm assess all of your joints and fingers. Okay, the color is consistent with the rest of the body. It is symmetric bilaterally. There are no lumps or masses. The venous pattern looks like it is within normal size, nothing protruding, and everything is the same on both sides, symmetric bilaterally, and it looks like the nails are round, and they're hard. There's no clubbing. Now I'm gonna assess for capillary refill. Okay, it's under 2 seconds. Now I'm going to test your elbow, so I'm gonna have you flex it for me. Now extend it. Okay, now pull this way for me. Pull it towards your body. Okay, push away. Now can I have you do this and do this? Pronate and supinate. Okay, now can I have you stand up for me? And then I would assess your brachial pulse, which is a normal 2+ regular rhythm. Now I'm going to assess your radial pulse. It's a regular 2+ rhythm. Now I'm going to assess your hip. I'm going to feel a bit. And then your knee, your ankle, butt, lift it up for me, and your toes, okay? It would be ideal to be able to see the skin, but I cannot do that right now. So I would observe that the color is consistent with the rest of the body. The venous pattern is normal. The veins aren't protruding. There's no masses, no lumps or lesions, and the temperature is consistent with the rest of the body, symmetric bilaterally. Now I'm going to assess the nails. It looks like they are round in size. There's no brittleness, no clubbing. I'm going to test the capillary refill. Okay, it is under 2 seconds. Now I'm going to assess the posterior tibial pulse. Normal 2+ rhythm. The dorsalis pedis pulse. Normal 2+ rhythm. Regular rhythm. Now I'm going to have you move out this way a little bit and turn this way. Lift your leg up like this. Now push down towards the floor. Okay, now I'm going to have you point your toe. It's plantar flexion. Now dorsal flexion, point it up towards the ceiling. Okay, now push against my hand. Okay, now push against it, up. Okay, now you can sit down for me. Throughout the whole exam, I would assess the level of consciousness. He is alert and oriented, ANO ×4, and the appearance and behavior is consistent. It is appropriate to the situation. Looks like there is sufficient hygiene, and the speech was clear and articulate. Thank you for your time today. You can get comfortable in your bed however you would like, and now I'm going to lower your bed to the lowest position, put your bedside table and reach and your call light, and then I would wash my hands.
Thank you.